What do you think about TRT for bodybuilding purposes in someone with a normal testosterone and no low T symptoms?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Well, we have to distinguish here what TRT actually means. Testosterone replacement therapy is just that. It is a replacement. To shut down a well-functioning endocrine system for the purpose of replacing it, when there's no guarantees that you're actually going to be able to kickstart it back and function optimally, once you're essentially done with your goals, this is not what testosterone therapy is. This is not medically monitored and endorsed replacement therapy. A therapy is there to fix a deficiency, not there to, give you an extra inch on your biceps. So let's just call it what it is, and then we can address the science behind it. It's essentially a steroid cycle. I'm not saying this in a derogatory way. My personal feelings on steroids is if you understand what you're putting in your body and you're an adult, you have the right to make your own decisions. There's no right or wrong here. No one should be judging you for it. And if your mental health and your, body dysmorphia or sense of feeling like you need to become bigger and you need this help because you've already trained naturally for years and you have your nutrition and training down and you feel you're at a time and point in your life and an age where you're going to benefit from this, then by all means, as an adult, you make your own decision. We're not here to condone or condemn your decisions. But let's just call it what it is. This is not TRT. TRT is not something that is utilized for the purpose of bodybuilding specifically, nor is it utilized for someone with, and I'm not going to use the word normal, but well-functioning or optimal hormone levels for the purposes of putting them in a super physiological level. That's not what medical replacement therapy is about. With that out of the way, if you're asking if going on testosterone is going to help you with a boost in training, the answer is absolutely yes. There's a reason that so many athletes utilize this behind the scenes and try to get away with it. If there was no benefit, they wouldn't be putting so much at risk. So absolutely. Now, if you're referring to TRT because of the dose, again, you have to understand even TRT in the way that we do it medically is very, very rarely done at a level of a naturally producing male, because most men don't produce nearly the levels of what TRT replaces. Because when we treat, we don't treat to replace dollar for dollar. We treat to replace an optimal level. So if your T was at, let's just say 400 nanograms per deciliter, that is what most would call normal within the range. But if you're going to be treated because you're symptomatic or because of your assessment and your age and other factors that you're provided to take into consideration, they decided to begin you on a treatment to treat you, to push you to back to 400 or back to 450 or 5. To me, that's silly, because if you're already going to go through the trouble of treatment, treat to optimize. Don't treat to normalize. So remember, the doses that you're going to be receiving may potentially double or triple your current naturally occurring levels. So even if you're what we call quote unquote normal, that's far possibly from optimal. So when you go to treat, you're going to optimize. And when you go to optimize, you're not only going to get the benefit of those higher levels, you're no longer going to get that circadian peak and valley on a daily basis. You're going to be optimized on a flat curve 24/7 if it's done correctly, and you're going to have more time under your belt throughout the days of being optimal. So your protein synthesis will not only double or triple as a result of your levels, but it's also going to exponentially be increased as a result of staying at those levels all the time. And that is where the real magic of TRT helps guys. Even if their levels on paper are where they used to be, now they're there all the time. They're not crashing at night, reproducing testosterone in their sleep, coming back in a morning peak and then crashing again. They're essentially hitting a pause button on that number and utilizing this 24/7. So they're getting a lot more efficiency under their belt for the same amount of given time. So let's say in a month, you would make X amount of gains, hypothetically. Now on replacement therapy done properly, when you hit your steady state, you're able to obtain 2 months worth of gains in a matter of 30 days because you spent so much more time in that optimal zone. But again, my take on this. It's your training and your nutrition and your recovery first and foremost. Testosterone is just, the tip of the iceberg. So the guys that are thinking, well, let me go out there and get on some T and, I'm going to double my size. Please don't take what I just said to mean that. So there's a lot more to this. But again, don't go on TRT because you want help in the gym. Go on TRT because you have a deficiency and you're being cared for by a proper provider who understands what they're doing. If you're looking to go on testosterone or any androgen for that matter, for the sake of performance enhancement, whether it's aesthetics or sports or et cetera, call it what it is, be honest with yourself, and then you can approach the topic correctly. And if you need help with it, we can do an informational consultation and, keep the harm levels down and try to optimize the best we can out of whatever it is that you're looking to do. But please distinguish between medicine and performance. They're mutually exclusive.
Great advice. Thank you, Gil.